drug like ours can be developed for more than one indication. It's called platform therapies. Go to next slide, please. So now I will not go into detail. What's the market size for these drugs? If you look at here, antipsychotic market is over $40 billion market. Schizophrenia alone is a $10 billion market. And then in that, if you look at this out of this 40 billion, and the schizophrenia almost a 7 billion, 6 billion market comes from the United States. That does not mean that more mad people are in the United States, but only difference is US drug is very expensive. So that's the reason. So bottom line here is not all antipsychotics, I'll come in a minute, not all antipsychotics currently in the market are used beyond schizophrenia. Only a handful of drugs are approved for treatment of beyond schizophrenia, such as bipolar and major depressive disorder. And ADHD is another disease where in India it was not a kind of a major concern because majority patient population until recently in the agriculture sector, so ADHD was not a kind of a noticeable in men. So these days, kind of a white collar job we call it, whether it's in a BPO or IT or whatever it is. So in one room you see around many people are packed. The ADHD people, they can't keep quiet. They are different type of people that disturbs others. So that's how more and more noticed by other people, and then they are forced to take treatment. So somebody works in the paddy field or something, that may not matter. So this, what I mean to say is, in the current world economy atmosphere, it is being noticed, and then people are more receptive to their treatment, especially psychiatric conditions. Psychiatric condition in the past, it was not perceived or looked upon something acceptable in society. It is like any other disease. There is we should be open to accept these patients. More and more we accept them, they recover very faster. It is not something contagious. If someone is schizophrenic or depression, it's not something that you will get from them. So if you are very empathetic to them and accommodative, so that helps them. So huge market, I will not go into detail. Please go to the next slide. So now I come to the next slide, please. How big is the market? How many patients are globally? How many patients are in the United States? If you look at the numbers here, you will see the seriousness of this disease. Schizophrenia globally, it's around 1 to 1.5% of patients suffer from schizophrenia. So in the US, around 4 million people. In Europe, around 7 million. In India, if you convert into around 1.5% in crores, it is around close to little over 2 crore people in India suffer from schizophrenia. It's a very serious problem. The schizophrenia treatment in many patients is lifelong, and then if not lifelong, it takes several years. So depression is another indication. Bipolar is again around the 3% world population suffer from bipolar. As you can see, I will not go into detail the numbers, but in India, bipolar patients are anywhere around 3 to 5 crores. Depression is much higher, close to 8 to 9 crore people suffer from schizophrenia, major depressive disorder, depression. Increasingly, we are noticing in India Alzheimer's and Parkinson's. Alzheimer's and Parkinson's movement disorder, we call it, clubbed together. It used to be diseases of something like grandpa, in the sense over 70. In the last 1 week, I traveled 12 sites, psychiatric sites, mainly kind of a rehabilitation center where families either put them with a bed or they abandon them. I've seen at least 3 patients in late 40s and early 50s, Alzheimer's. this is something they're very concerned. It may be lifestyle or various things related to, we don't know. It's a very major problem. Bottom line is, millions of people suffer from mental illness, neurological disorders. India is not immune to that. So considering that why Western countries, Alzheimer's and Parkinson's are major concern, because in Western countries, almost 50% of geriatric patients, in the sense they are elderly patient population. In India, we have currently kind of more younger patients, but it won't take much time. Maybe in the next 20 to 30 years, you will see more older people. It's a really major problem. You can't abandon them. You have to treat them. It's a bigger problem. So now, treating these patients, more and more research involved, and then developing new drugs in the country. This helps patients, and then they can have quality of life. So now with this, often these neuropsychiatric conditions are kind of significant overlapping in symptoms. Now, coming to mainly is for schizophrenia. If you look at schizophrenia, you may think that it's a single disease, but schizophrenia is not a single disease. Rather, it is a cluster of at least 4 major conditions. One is we call positive symptom. What is positive symptom? Positive symptom is basically these patients, they get some picture, they hear some sound, music all the time, and these are the major conditions. Negative symptoms is kind of a condition where we call flattening, or maybe a psychiatrist here as an expert. So it's called a kind of in other words, in a very layman term, if you look at it. We, normal people, whatever we do, for example, you go to shopping, you go to movie. When you watch movie, you enjoy. Normally schizophrenia patients, they don't get pleasure. They don't enjoy. So when somebody says if they don't enjoy anything, that's a big concern. Because normal people will enjoy. This is a negative symptom. Because schizophrenia condition, negative symptoms, not enjoying, cognitive improvement, these are all starts much early on, before we notice these patients are schizophrenic. So these are all the early symptoms of cognitive impairment, as well as the mood symptom, we call it medical term. Mood is nothing but anxiety and then depression. So anxiety is not a problem, we all have anxiety, but the thing is, there is a medically, when it bothers, there is something wrong. So that's the thing. So a drug, ideally, should be able to treat all these symptoms, but in reality, that's not the case. Currently available drugs have a lot of problems, and then there are various unmet needs. That's what the unmet need in the title. I'll walk through some of the unmet needs and take the rest of time. I'll quickly go through this book next time. Here, as I mentioned, just briefly touch upon, there's a processing that, ADHD and other things here, often when kids in the school see they are not attentive, then maybe the first thing is at home, mother is bothered, in school, teachers. Some students can be really different. So we call them as, they are naughty or whatever it is, something, they are not regular students. But this could be a problem, attention deficit. That's an early listening. Because in young children, it is very hard to diagnose schizophrenia. So this could be diagnosed kind of variety of, we club together maybe ADHD, or if it is a very extreme cases in some kind of autism spectrum, various other things. But real schizophrenia start diagnosing sometime when they reach teenage. So teenage, most of the patients, what we see in the clinical setup, early onset of schizophrenia in the teenage. So when these patients take treatment in early their life teenage, they start accumulating a lot of side effects, various other issues are coming in. The bottom line here is mood symptoms, anxiety, and then cognitive impairment, negative symptoms. They all start early, maybe 3 to 5 years early. And suddenly when they get flare of positive symptoms, then they say they hear some voice, music, some pictures, all these things, then we start recognizing a schizophrenia patient. that's called positive symptom or acute patients. So in the current treatment, major drugs currently in the market, 4 to 6 weeks of treatment, they become stable. The positive symptoms are reduced, and then the negative symptoms, cognitive and then more, they are hard to treat. They require, in the medical term, we call them residual symptoms. It requires years to lifelong treatment. So, look next slide. So here it is a, why do we need new drugs? Currently, in the last 50 years, almost 15 drugs are approved. Out of that, 10 drugs are currently in the market. Out of 10 drugs, 6 drugs are widely used. They capture 90% of the potential $40 billion market. So if drugs are there, why do we need more drugs? If you look at the extreme right-hand side here, in the current treatment setup, 4 to 6 weeks of treatment, around 30 to 50% patients discontinue current medication, widely used medication. In the long term, up to 70% patients discontinue medication. So why do patients discontinue medication? A, because drug doesn't work in that. Because, and then second, side effects. So often when we think that, we often think side effects are more, but drug also, currently available drugs are suboptimal in treat all the symptoms. So when you say side effects, even the side effects are there, why do drugs are getting approved to market? So all drugs are known to cause side effects. The no drug currently in the market are 100% safe. So when doctors prescribe medication to patients, it's always see risk versus benefit. If a patient doesn't take that medication, what's the risk? Maybe if you take medication, despite having some side effect. So that is better than not taking. That's the bottom line. So that's the reason why, even though drugs are there in the market, we continue to develop new drugs. And so that's why we continue to develop new drugs. Now, the side effects. So, coming to the efficacy, why in 4 to 6 weeks of treatment, in schizophrenia treatment, patients, acutely ill patients, get stabilized. And after that, the negative symptom, mood and cognitive, with the currently available drug, many patients do not respond to that. That's where the problem comes. And then also, the many drugs currently in the market are known to cause side effects. They are by and large classified into 3 different categories. One is neuroleptic side effect. What's that mean? It's a CNS side effect. When I mentioned, most of the patients, they get the disease in the early stage, the teenager. After a year of treatment, with the current treatment currently available, one may be slightly better and maybe slightly worse. If you look at after 2 to 3 years of treatment, often at the age of 20, their hand shakes. Even they cannot hold a cup of water that shakes. This is the side effect associated with the drug. And then also, we call them the neuroleptic side effect. This is the reality in the treatment. And then also, many drugs are known to cause hormonal imbalance. Particularly, there are 2 hormones that are very important with the widely used medication are known to imbalance. So one is prolactin. Prolactin is a hormone. Increasing prolactin hormone can enlarge breast in both men and women. In men, enlargement of breast could be a serious problem. And then also, in women, this can be predisposed to breast cancer. So enlargement of breast can lead to increasing prolactin, sexual side effect that disrupts their social life. Many patients try to commit suicide, and then 3% of patients actually they commit suicide. Many schizophrenia patients commit suicide. That's the reality. That's why we need new medication. Other thing is, many drugs currently in the market are known to cause hypothyroidism. So thyroid, many people have thyroidism. It's not a big deal. But the problem with hypothyroidism is often hypothyroidism patients develop depression, and then that lead to other complications, overweight, and then various other problems comes. These are drug-induced side effects in many patients. The lastly, we call metabolic side effects. there are three things that are very important in metabolic side effect. One is weight gain, second one is drug-induced diabetes, third one is dyslipidemia. In other words, in the common term we call it cholesterol increase. So how serious is this problem? Many antipsychotics currently in the market, in 4 to 6 weeks of treatment, known to increase around 6 to 8 pounds weight gain. This is a serious problem. Sometimes 16 to 18, 17 years old children, they weigh around 80 to 90 kilos. It's very disheartening to see them after the treatment. So these are the side effects associated with the drug. Now,